You've stood up from a chair and had no idea where your feet were. Not a metaphor, a hard medical fact. Millions of people wake up every single day and discover that their legs feel like they belong to someone else. Burning, tingling, numbness, the sensation of walking on bubble wrap or a thick layer of foam, not knowing whether the floor beneath you is solid or not. And here's what nobody is telling you. 1 in 3 people with diabetes develops neuropathy of the lower limbs. 1 in 2 of them doesn't find out until they start falling. Falls in people over 65 are the #1 cause of traumatic death. 1 in 5 people who fall at that age breaks a hip, and 1 in 4 of those people will not be alive a year later. This is not a minor inconvenience. This is a life-threatening condition, and it is treatable. Subscribe and hit like right now. Help Dr. Watling reach 100,000 subscribers. What you're about to hear is not what they'll tell you at your next appointment. The healthcare system makes its money from patients who keep coming back, not from patients who get better. That's the truth. I'm giving it to you straight. Let's start from the beginning. What is neuropathy in plain human terms? Your body contains billions of ultra-thin signal wires. They run from your brain down through your spinal cord, branch out through your entire body, and reach all the way to the tips of your toes. Signals travel along these wires in both directions constantly. Every fraction of a second. Your brain asks your foot, where are you? How firm is it? Flat surface or angled? How much pressure under the heel? Your foot answers, all good, firm, flat, moving. That two-way conversation is called proprioception, your body's ability to sense its own position in space. You don't notice it when it's working, just like you don't notice your breathing. It runs silently in the background, but the moment it breaks down, you feel it immediately. Neuropathy is damage to those signal wires, and more precisely, it's damage not to the wire itself, but to its insulation first. Every nerve is wrapped in a myelin sheath, a layer of fatty material that acts exactly like the plastic coating on an electrical wire. Without that coating, the signal leaks out along the way. It loses strength. It bleeds into adjacent signals. The result is chaos. Your brain gets distorted information, or it gets nothing at all. That's where the burning and tingling come from. The nerve is firing false alarm signals like a short-circuiting wire, and numbness, that is the next stage. The nerve is so damaged that it stops transmitting altogether. The brain sends a request and gets silence, and it starts literally guessing where your foot is. Now, why does this happen? 3 main causes, and all 3 are more common than most people realize. The first is diabetes. Elevated blood sugar acts like acid on the walls of the tiny blood vessels that feed your nerves. Those vessels constrict. The nerve stops getting adequate oxygen and glucose. Degeneration begins. That means progressive destruction of the nerve fiber. This is called diabetic peripheral neuropathy. According to global medical data, it develops in 30 to 50% of all people with type 2 diabetes. And in half of those cases, it's completely silent in the early stages. The person is already losing nerve fibers. They feel nothing yet. The second cause is chemotherapy. The drugs that destroy cancer cells cannot tell the difference between a malignant cell and a nerve fiber. They hit everything that divides rapidly or that is sensitive to their mechanism of action. Neurotoxicity, that means nerve damage caused by the drugs themselves, develops in 30 to 60% of patients who complete treatment regimens based on platinum compounds or taxanes. This is one of the most common and most painful long-term consequences of cancer treatment, and almost nobody talks about it because the focus is always on survival. Yes, survival is what matters most, but living without feeling your own feet is not living at full capacity. The third cause is circulatory insufficiency, reduced blood flow connected to aging, atherosclerosis, and a sedentary lifestyle. Atherosclerosis means the buildup of plaque inside the artery walls, gradually narrowing them. The vessels feeding the nerves constrict. Blood flow drops. The nerves start to starve. This is a slow, gradual process that goes unnoticed for years. Then one day, a person gets out of bed and realizes something is wrong with their legs. They go to the doctor and they hear, neuropathy, age. Learn to live with it. I want to stop right here and say something clearly. Learn to live with it is not medicine. That is surrender. That is a physician who either doesn't know what to do next or doesn't want to spend the time, because the evidence base says something very different. Studies published in leading medical journals show that aerobic physical activity increases nerve conduction velocity in patients with diabetic neuropathy. That is a measurable objective finding confirmed on electroneuromyography, which is a specialized test that measures the speed at which an electrical signal travels along a nerve. Other studies demonstrated that regular exercise increases the density of nerve fibers in the skin of the foot. That means the nerves are literally growing back. This is not wishful thinking. This is neuroplasticity in action. Neuroplasticity is the key concept here. Let me explain it simply. Your brain and nervous system are not fixed, static structures. They continuously reorganize themselves. When one pathway is blocked, the system looks for a detour. It builds new connections. This happens in response to specific inputs, movement, physical load, coordination tasks. It's the same reason people relearn how to walk and speak after a stroke. The brain redistributes functions across healthy regions. The same process occurs with neuropathy. The right movements push your brain to search for new pathways to the feet, strengthen blood flow to damaged nerves, and activate intact nerve fibers that take over the work of the ones that have been destroyed. It is slow, it requires patience, but it works, and it is backed by scientific data. Now let's get practical. 4 exercises. For each one, 2 variations, seated and standing. Read through the full description first, then perform. If something is unclear, reread it. If you have any doubts about your current health condition, see your doctor before you start. Exercise 1, marching in place. This is the aerobic foundation of the entire routine. I start with it for a specific reason. A nerve is living tissue. Living tissue needs oxygen. Oxygen is delivered by blood. While blood flow to the legs is poor, the nerves continue to starve, and no other exercise will produce its full effect. The first step is to get the blood moving, literally. Even light rhythmic activity, marching in place for 30 to 60 seconds, increases your heart rate and dilates blood vessels in the lower limbs. This is called active hyperemia, the enhanced delivery of blood to working muscles. That blood carries oxygen, glucose, and nerve growth factors. At the same time, it removes metabolic waste, lactate, pro-inflammatory molecules that accumulate around damaged nerves pain. So marching simultaneously feeds the nerves and clears away what is preventing them from recovering. On top of that, the alternating movement, right knee up, right arm forward, left arm forward, activates both hemispheres of the brain simultaneously. This stimulates the central nervous system and re-engages it with the lower limbs. Technique. If you are seated, sit upright, back not touching the chair back. Lift your right knee, lower it. Lift your left knee, lower it. Arms move naturally. Right knee up, left arm forward. Left knee up, right arm forward. This is not just a simulation of walking. This is a precise reproduction of the locomotion pattern, the way the brain coordinates movement of the lower body. You are literally reminding your brain how to coordinate your legs. If you are standing, hold a chair or a countertop. Lift your knees high enough to feel real work in your thigh muscles. Start with 30 to 60 seconds. Over several weeks, build to 1 to 2 minutes. This exercise fits into any moment of the day, waiting for the kettle to boil, standing at the stove, commercial break, on television. Get up, march, sit back down. The brain does not need a dedicated hour. It responds to any consistent, repeated stimulus. Exercise 2, heel to toe rock. Now, we move to targeted work on the specific muscles and joints of the foot. Here's what happens to your biomechanics with neuropathy. You stop feeling the foot normally. You start to fear stumbling. You stop lifting the front of your foot during each step. You begin to shuffle, sliding the foot along the floor instead of lifting it. This is a protective response from the body, but it is counterproductive. The less you move the foot and ankle, the more the muscles atrophy, the worse the blood flow to the nerves in that area, and the higher your fall risk becomes. A vicious cycle that needs to be broken. The tibialis anterior, the muscle running along the front surface of the shin, is the one that lifts the front of your foot with every step you take. When it weakens, the toes drop during walking and catch on any unevenness. That is exactly why people with neuropathy trip over thresholds, carpets, and sidewalk cracks. The gastrocnemius and soleus muscles, the muscles at the back of the shin, what most people call the calf, are responsible for pushing off the floor with each step, providing the forward impulse that propels the body. When they weaken, your gait becomes sluggish, your stride shortens, and your walking speed drops. And walking speed, by the way, is one of the most powerful predictors of longevity in older adults. That is not a side comment. That comes directly from large-scale epidemiological studies. Technique. Both feet on the floor, hip-width apart. Slowly raise both heels as high as you can. The balls of your feet and your toes stay on the floor. Hold at the top for 1 to 2 seconds. Feel the contraction in your calves. Slowly lower your heels back down. Then the opposite. Roll back. Raise the front of the foot and toes up off the floor. Heels stay down. Feel the burn along the front of the shin. That is the tibialis anterior waking up. In most people, this muscle is chronically underused because all our shoes are rigid, all our surfaces are flat, and the muscle has been barely working for years. Do 10 to 20 of these rocks. Do not rush. Every movement is slow and deliberate. You are not just training a muscle. You are simultaneously sending the nervous system a rich stream of sensory signals. Pressure under the ball of the foot, stretch in the Achilles tendon, changing angle at the ankle. All of that is information for the brain about where the foot is in space. Exercise 3, diagonal sweep. This exercise combines several goals at once: strengthening the core muscles, coordinating the upper and lower halves of the body, and most importantly, continuous stimulation of the nervous system through the feet. Let me explain the logic. Balance is not about your legs, or rather, not only your legs. Balance is the product of a constant conversation between 3 systems: the vestibular system in the inner ear, the visual system in your eyes, and the proprioceptive system in your joints, muscles, and feet. When one system is damaged, when neuropathy has knocked out proprioception, the other 2 take on more of the load, but they cannot fully compensate. What you also need is a strong, stable core. The stabilizing muscles of the spine and abdomen hold your center of gravity above your base of support. Without that, even a healthy person will lose balance with any sudden movement. Technique. Sit on the edge of the chair, both feet flat on the floor. Now, and this is critically important, actively press your feet into the floor. Don't just place them there. Press down as if you were trying to leave a footprint in the floor. This action alone is a neurological stimulus. Pressure under the foot activates mechanoreceptors, specialized nerve endings that respond to pressure and stretch, and sends a signal up the nerve chain to the brain. Even that simple downward pressure begins to reestablish the connection between the brain and the foot. Clasp your hands together in front of you, lower them toward your left hip. Now slowly sweep them diagonally upward through the center of your body, all the way to the right shoulder and higher, up toward the right side above your head. Return to the left hip. That is 1 repetition, 10 to 20 reps, then switch sides. From the right hip up and to the left. If clasping the hands is uncomfortable due to shoulder joints, simply move both hands together in parallel. While you perform that sweep, your core is forced to stabilize a shifting weight, and the entire time your feet keep pressing into the floor. The nervous system is simultaneously processing signals from the foot receptors, signals from the abdominal and back muscles, and signals from the shoulder girdle. That is a complex coordination task. Exactly these kinds of tasks trigger neuroplasticity. The brain is forced to build and reinforce new neural pathways. Exercise 4, modified single leg stance. This is the peak of the entire routine and the most powerful tool for restoring balance. This exercise replicates the actual demand placed on the nervous system during walking. Every single step involves a fraction of a second of standing on one leg. If that ability is compromised, every step becomes a potential fall. But we are not going to take unnecessary risks. Stand in a corner of the room facing the room. The walls are behind you and to the side. In front of you is a chair with a back. That is your safety net on 3 sides. Shift all of your weight onto your right foot. Take your left foot slightly behind and allow only the toes of the left foot to barely touch the floor. Like a tripod's third leg, just a light point of contact. All your weight is on the right leg. And now, the most important detail, do not lock your supporting knee. Keep a slight, soft, barely perceptible bend in it. When you lock the knee out straight, you transfer all the load onto the joint and bone, the muscles switch off, and balance becomes passive and mechanical. When the knee is slightly bent, your thigh muscles, calf, and ankle are all working. And then you will notice your ankle is making constant, tiny micro adjustments to keep you upright. That trembling, that subtle swaying, that is not weakness. That is your nervous system working. That is hundreds of nerve signals per second firing between your foot and your brain. That is exactly what we need to stimulate. Hold for 30 to 60 seconds. If you can, take your hand away from the chair or leave just one fingertip for psychological security. All weight on the left leg, right toes touching lightly behind. Too difficult. Place the back foot fully on the floor slightly behind. This widens your base of support and makes the task easier. Want to progress? Lift the back foot completely, true single leg balance. Advance gradually, week by week. Push the progression too fast and you increase fall risk. Progress it too slowly and you stop triggering meaningful adaptation. Now, how to build regularity. Start with 2 to 3 sessions per week. That is not an arbitrary number. After neuroplastic loading, the nervous system needs time to consolidate, to lock in the new connections. Think of it like writing to a hard drive. Data first gets written to temporary memory, then transferred to long-term storage. If you load the system every single day without recovery, that transfer doesn't complete and progress stalls. If you load it too rarely, the adaptive signal fades. 2 to 3 times per week is the optimal frequency supported by rehabilitation research on neuropathy patients. A study published in a peer-reviewed journal on diabetic neuropathy showed this. 8 weeks of aerobic exercise in patients with diabetic neuropathy, 3 to 6 sessions per week, 150 to 360 minutes per week total, produced significant, statistically verified improvements in nerve conduction velocity and reduced scores on the neuropathic symptom scale. 8 weeks, 2 months of consistent work, and measurable, objective improvement on instruments. Not the subjective sense that things feel a little better, actual numbers on electroneuromyography. A separate study documented an increase in nerve fiber density in the skin of the foot, meaning the nerves did not merely stop deteriorating, they actually began to regenerate. This happens under conditions of regular, appropriate physical load. The most common mistake I see in clinical practice, someone starts too aggressively. They exercise every day, full effort, ignore fatigue. After a week and a half or 2 weeks, pain or exhaustion appears and they stop. Then they say, I tried, it didn't work. No, you didn't try. You burned out your engine in the first week. The nervous system recovers slowly, especially when the damage has been accumulating for years. Be patient. Start with the easiest variation of each exercise. Use support. Do not rush progression. Your goal for the first 2 to 3 weeks is simply to build the habit and feel the movements. Everything else will follow. Here is one more aspect that almost no one talks about: footwear. With neuropathy, your choice of shoes is not an aesthetic question. It is a safety question. A rigid sole, a narrow toe box, a raised heel, all of these rob the foot of information about the surface beneath it and restrict movement at the ankle joint. Your brain is already receiving fewer signals from damaged nerves. Why add further sensory deprivation through a rigid, insulating sole? Choose shoes with a flexible sole, a wide toe box, and no significant heel elevation. At home, do not walk in socks on smooth floors. Use non-slip socks with a grippy sole or soft slippers with a secure fit. This single, simple change immediately reduces your fall risk. And one more factor: nutrition support for the nervous system. Neuropathy accelerates in the presence of vitamin B12 deficiency. That vitamin is the raw material for the myelin sheath, the insulating layer around the nerve fiber. Without adequate B12, nerves degrade faster and recover more slowly. B12 deficiency is especially prevalent in people over 60. Absorption from food declines with age. It is also very common in everyone taking metformin, the most widely prescribed medication for type 2 diabetes. Metformin blocks the intestinal absorption of B12. So the drug being used to treat the diabetes is worsening the neuropathy that the diabetes caused. Every physician who prescribes metformin should warn their patient about this. Ask yours, did they? Have your B12 blood level checked. It is a simple test. If it is below 300 picomoles per liter, you need correction. Also relevant is alpha lipoic acid, an antioxidant that protects nerve tissue from oxidative damage. Several clinical trials show meaningful benefit in diabetic neuropathy, but on this one, only with physician guidance. Dosage, formulation, and duration of use all matter, and self-prescribing can do harm. The rate of neuroplastic adaptation and the body's response to exercise change significantly with age. After 55, the nervous system's capacity to build new neural pathways is roughly half of what it is at 40, but it does not disappear. It simply takes more time and more patience. Drop your age in the comments below. I want to know who is watching this channel so I can give more targeted recommendations and focus on the age groups and risk profiles that matter most to this audience. If you're over 60, your nerve recovery timeline looks different from someone in their 40s, and I want to address that directly in future content. Here is exactly what you do after watching this video. First, stand up and march in place for 30 seconds right now, not later, not tomorrow, now. That is the first signal to your brain that the work has started. Second, do the heel to toe rock, 10 repetitions slow. Third, sit down and do the diagonal sweep, 10 reps to each side. Fourth, stand in your corner, find your support, and hold the single leg stance for 30 seconds on each side. Altogether, this takes 8 to 10 minutes, 2 to 3 times per week, 8 weeks, and you will see a difference. Not because I am promising a miracle, because this is confirmed by data. The nervous system responds to the right stimulus when you deliver it consistently. Do not wait until the neuropathy progresses to the point where falls become inevitable. Start today. Start at whatever level you can manage right now, and do not stop. No one in a white coat at a clinic is going to walk you through this. It's not profitable. The system earns from your follow-up visits, not your recovery. That's not a conspiracy, that's economics. Subscribe to Dr. Watling and hit like if you want the straight clinical truth. We are building toward 100,000 subscribers, and every single person who subscribes moves that goal forward.